Smoking ranks as one of the leading causes of preventable deaths worldwide. But with 1.3 billion people still smoking, what happens when you decide to quit? Within just 20 minutes of stopping, both your blood pressure and heart rate stabilize. This is because nicotine in cigarettes triggers the release of epinephrine and norepinephrine, which elevate heart rate and constrict blood vessels. Smokers often experience colder hands and feet due to these effects, but by now those extremities have warmed up to their normal temperature. At the 2-hour mark, nicotine cravings start to kick in, bringing feelings of irritability, drowsiness, tension, and sometimes trouble sleeping. Nicotine's ability to boost dopamine release explains these physiological responses as your body begins adjusting to less dopamine production. After 8 hours, the carbon monoxide levels in your body begin to clear, allowing oxygen levels in your bloodstream to normalize. Carbon monoxide competes with oxygen for hemoglobin binding, which strains your circulatory system. For long-term smokers, carbon monoxide exposure enlarges red blood cells, making the blood thicker and leading to higher blood pressure and a greater risk of blood clots. Surprisingly, 24 hours after quitting, you may find yourself coughing more as your body starts to expel toxins from the lungs. At the same time, your risk of developing coronary artery diseases begins to drop. By 48 hours, nicotine and its byproducts have been flushed out of your body entirely, allowing damaged nerve endings to start healing. Chemicals in cigarettes, like tar, can diminish the sensitivity of taste buds, but now, your sense of taste begins to return, making food more flavorful. Although in long-term smokers, some damage to taste buds might be permanent. Nicotine withdrawal peaks around the 72-hour mark, bringing on symptoms such as headaches, nausea, and cramps. Emotional effects like anxiety and depression are also common. These symptoms are typical with addictive substances, including caffeine, but once you pass this stage, the worst is over. After 1 month, your risk of developing type 2 diabetes, cardiovascular diseases, and various cancers has already decreased. In 3 to 9 months, the tiny hair-like structures in your lungs called cilia, responsible for clearing away dust and debris, are almost fully healed, significantly reducing coughing and shortness of breath. By the 1-year mark, your risk of heart disease due to plaque buildup in arteries drops by nearly 50%. 10 years after quitting, the chance of developing lung cancer decreases to half that of a current smoker. And in 15 years, your risk of a heart attack falls to that of a non-smoker. However, these timelines are not fixed, as your recovery depends on factors like how much and how long you smoked. Unfortunately, some lung damage is irreversible, and the risk of lung disease remains slightly higher compared to someone who never smoked. Although quitting can be challenging, the long-term benefits far outweigh the discomfort of withdrawal. The best course of action, however, is to avoid smoking altogether. Need extra motivation? Check out our videos for tips on how to quit or focus on other goals you're striving to achieve. Feel free to leave us your burning questions in the comments or on social media. And don't forget to subscribe for more health content.